Welcome back to this next video in which we are discussing cataracts and cataract surgery. Okay, so we've now discussed the anatomy of the eye and we've discussed the histology of the lens. Next it is time to discuss the physiology of the lens. So the first thing I want to talk about is what is meant by the power of a lens. So simply, the power of a lens is how good that lens is at focusing light. So, it's measured in the units of diopters, and I want to explain what actually one diopter means. So, what does it mean if a lens is 1 diopter in power? So this is the units for the power of a lens. So to do this, let me just draw a picture of a lens. And you can imagine now that this is a glass lens rather than a biological lens. And there is a perfect shape for a lens to be, which is more this sort of shape where it's perfectly symmetrical down this vertical line rather than the shape that a biological lens is. However, certainly a biological lens approximates one of these perfect elliptical lenses in this way. Okay, so what is then meant by having a 1 diopter lens is that if you were to shine light rays that are all parallel to one another into this lens, so let me draw some of these. So we're going to have lots of parallel light rays all coming into this lens like so. So I'll go for 5 overall. If this lens was 1 diopter, then these parallel light rays would all be focused onto a point that is 1 meter away from the lens. And I know this is a bit out of scale, but let's say this is 1 meter here away from the lens. So if this is 1 meter away from the center of the lens, of course, here, then all of these light rays will be focused onto that. And it's a little bit difficult to draw because they'd be focused, well, their direction of movement would be changed by both coming into this surface of the glass and also coming out of this surface of the glass. So they'd be bent a little bit by this interface with the glass, like so, but then they'd be bent further by this interface with the glass here, where they're going back into air, and they'd end up coming there. And it would be the same for this one, so this one would bend slightly like so, and then it would bend further when it comes out the other side, and then it would go to that point, and I missed that point that time, but ideally, if the picture was going perfectly, it would end up there. And the same for this one, like so, and we'll do it for these two down here as well. So this one will bend like this towards the center, and then it will bend again towards the center here and head to that point. This one will bend towards the center, bend to the center again when it exits, and then head to that point. So all of these parallel light rays that you can imagine are coming from something very, very far away. So for instance, if you're looking at the sun is very, very far away, and all of the light rays that are reaching this lens from the sun, they're effectively all going to be parallel to one another. Okay, yes, they're not actually perfectly parallel to one another, but they're effectively parallel to one another. And the lens will focus them all to a point 1 meter away if it is a 1 diopter lens. So if this is a 1 diopter lens, then all light rays that are moving parallel to one another will be focused to a point 1 meter away from it. Now, see if you can spot the pattern. If the lens was a higher power, let's say 2 diopters, then my claim is that all these light rays which are parallel to one another would be focused to a point that is 0.5 meters away, so it would be here rather than here. If it was 4 diopters, and I'm just going up to 4 rather than 3 simply so the numbers work out nicely, it would be focused to a point 0.25 meters away. Okay, so hopefully you get the idea now. If it was a 20 diopter lens, which is actually approximately the power of the human lens in the eye, it's more about 18, but 20 is the usual approximation, then it will be focused to a point 0.05 meters. So all you do is you take 1 meter, divide it by the power, and that gives you the distance away from the center of the lens that all these light rays coming in from infinity, if you like, all parallel to one another, would be focused to. That is what is meant by the power of a lens. It tells you how good the lens is at focusing light, how short away the distance is where all of these parallel light rays will be focused onto. So that, I hope, gives you an insight into what power of a lens means. And generally, lenses that are very thin, like one like so, will be low power, whereas lenses that are big and globular, like this, will be high power. So this one will focus light rays coming in parallel to one another to a distance shorter than this one would. So this is the low power, this is the high power. This one will have a shorter distance away for which the point, and indeed this point we can refer to it as the focus point. So this is the focus point, the point where all the light rays are being focused to. The focus point for this one will be less far away than for this one. Okay, that's all power means. So it's a very intuitive concept. Now, coming back to the human eye, of course we're not always interested in focusing light rays that are parallel to one another onto a point. What we're far more interested in is focusing divergent light rays onto a point. So for instance, let me give you an example why you actually want something to be doing this in the eye. Let's say you have a candle, like so. So here is a candle, here is the flame, and you are now going to look at the flame of this candle. So I'm just going to colour it in. So there's the flame of the candle. Now, if we just built an eye by building a retina, so let's have a retina like so. So let's say I'm creating the human eye and I'm doing a bad job of it, so what I'm going to create is just a retina like so. So this is representing just the retina, and I've forgotten to put in a lens, forgotten to put in the cornea, because the cornea actually plays an extremely important part in focusing light as well. How am I going to see this candle? Well, light is going to be coming from the flame of the candle, and it's going to be diverging away like so. So there'll be light coming like this at all these divergent angles. And can you see what's going to happen? Where am I going to actually see the candle as being? Well, I'm going to have all of this space on the retina now corresponding to this tiny little point in three-dimensional space. How am I actually going to make sense of this when the information from this tiny point, the light from this tiny point of space, is going to a massive great portion of the retina here? That is what we're trying to stop. What we want is all of this divergent light that is coming from the candle here, all of these light rays that are diverging away from the candle. We want them to be focused onto a small part of the retina so that the information about the candle comes onto a small part of the retina, because after all, the retina, it has to take information from all over your visual fields. So we need little parts of we need little bits of the retina to be corresponding to little parts of reality. Okay, we can't have a tiny little part of reality here corresponding to an entire huge great part of the retina here. Okay, this should just have a little portion of the retina that's going to see information about it, and then we can sort of make sense of this information. If we had, loads of candles all over the place and this was my design for the eye, it would be nonsense. You wouldn't be able to make sense of it at all. So we need this to just come onto a small portion of the retina that corresponds to that position in three-dimensional reality, and that is the point of the lens. So this is obviously more complicated because so far we've just talked about focusing light rays coming from infinity. It is more difficult for a lens to focus light rays that are divergent in this way. So if you imagine now, instead of having light rays that are all parallel to one another coming into this lens, you're going to have divergent light rays, and I'll draw another picture of this. So let's have another lens here, like so, and let's have a divergent light source here, like so. So it's going to have light rays coming in like this. So the question now is, where does this lens focus all of these light rays to? Well, this lens has a certain power, okay? So let's say its power is 20 diopters. So let's say the power of this is 20 diopters. So that would mean that if all of the light rays were coming in parallel, then they'd all be focused to a point 0.05 meters away from the center of the lens. But they're not all coming in parallel now, they're coming in divergent. The focus point for these divergent light rays will be further away than the focus point for the parallel light rays. I hope that is reasonably intuitive to you, because it's more difficult to focus divergent light rays like this than it is to focus parallel light rays. So this might be 0.5 meters here. Okay, the focus point for these divergent light rays will be much further away than that. And indeed, physicists have a formula by which you can actually work out how far away the focus point would be, but I'm not going to go there. All that we need to intuitively understand is that it will focus usually, but it will be further away than would be the focus point for parallel light rays. Okay, right. So this now is the basis for why we have a lens in the human eye. So what we are going to do is we're going to put a lens here, and this is going to focus all of these divergent light rays onto a small area on the back of the retina. Maybe not quite onto a point, but onto a small area on the back of the retina. That is the idea behind the human lens. So I'll just put this here. In fact, actually, I'll draw another picture for this alongside. So now what we're going to do is we're going to put the apparatus for converging the light rays in here. So here is the candle, and here is our eye, and now what I'll do is I'll put the two things that are going to focus the light in. We'll have the cornea and also the lens. Now I'll draw the iris very small. Let's imagine it's very dilated, because it makes, well, the pupil is very dilated, because it makes the picture just more complicated if I've got to try and make it so that the light rays go for a tiny little pupil. Okay, so here then let's have the ciliary body, like so. I should really be drawing the choroid going all the way around, but I'm not fussed about that at the moment, so I'll just draw the ciliary body here. The choroid would go all the way around, like so, though. Okay, so here's the ciliary body, and we've now got, just complete that up, don't like messy pictures, and then we've got the lens here, like so, suspended by the suspensory ligament. So here is our better design for the eye. Now what is going to happen? Well, again, light rays are going to be coming in to our eye that are diverging in this way, like so. And this time what's going to happen is that the cornea and the lens together are going to gradually bend these light rays. So the cornea will firstly bend light rays, and do not underestimate the importance of the cornea. The cornea is very important for bending light rays. And then the lens will bend them further, and hopefully focus them down onto a certain point on the retina, and that small point now will be receiving information about this small point of reality. That is a much better way for this to work than this. Okay, this you can't actually extract any information. If you had loads of candles at different points in reality, they'd all be illuminating the retina, and how are you supposed to get any information from that? You need small points of reality focused onto small points of the retina so that you can actually harness some useful information. Okay, so that is the function then of the cornea and the lens. Let me just now, to finish this discussion of the physiology, talk about accommodation. So accommodation means changing the shape of the lens depending on the distance of the thing that you are trying to focus. Okay, so the next problem that you have to think about is, what if you move the position of the candle? So if you imagine now changing how far away the source of the light is from the lens. This is something that I just skipped over previously when I was describing this. So far what we've discussed is the fact that if you have this divergent light source, that the focus point will be further than this point for the focusing of parallel light rays. Now how far away will it be? Well, hopefully you can appreciate that if this thing is very, very close up to the lens, so if I bring it really, really close up to the lens, then the light rays will be much more divergent as they enter the lens here, and therefore the focus point is going to be much further away. It's much more difficult to focus them. So if I put the source point here this time, can you appreciate now that those light rays are much more divergent, and that this is going to have a harder time focusing those? So the focus point will be moved back further still, like so. Okay, so the focus point for focusing light rays that are coming from a certain source point depends not only on the power of the lens, but also on where you've actually positioned the source here, how close the source is to the lens. Right, so the idea now is, look, if we have this candle and it's at different positions away from our eye, then these different positions, they're going to be focused at differing distances away from the lens. So the candle being here was perfect. The lens was the perfect power here to get the focus point on the retina. But what if we moved it really close up? That's much more difficult to focus, remember now. So the focus point would be further away. It would be back here, and therefore the light wouldn't be very focused once it gets to the retina. Instead, you'd be catching it at maybe a point like this. So actually I'll put it here. So if you imagine that this is the retina, let's say the lens was perfectly shaped to focus light at this position onto the retina here, but now if we move the light source to this position, look, the focus point is here, and instead when it arrives on the retina, you're going to have this unfocused patch here. It's not going to have got to a focused point yet. It's still going to be a large patch. Yes, a lot's better than this, but still a larger patch of retina is going to be receiving the information about that candle light than we would like, so it's going to appear unfocused. So if we wanted now to be able to focus light coming from this nearer point onto the retina, we're going to have to increase the power of our lens. We're going to have to change the shape of it. And that is what accommodation is all about. That is the other role of the ciliary body. It changes the shape of the lens, changes the power of the lens, and the reason you want to do that is so that you can focus light sources of divergent light rays that are differing distances away from you onto the retina, because one size for the lens does not actually fit all, and that will be one of the problems that we'll see when we actually discuss cataract surgery, because when you have a replacement lens in cataract surgery, you lose the ability to accommodate. That lens is not going to change shape anymore, it's a fixed shape. So really you end up just being able to focus objects that are a certain distance away from you onto your retina, or at least within a certain window, and you're not so good at focusing objects that are outside that window of distance away from you onto the retina. But we'll discuss all of that again when we come on to cataract surgery. So to summarise this then for now, if you've got a light source that is very, very far away from you and you want to focus that onto the back of the retina, then you'll need the lens to be lower power, because it's less difficult to focus those light rays onto the back of the retina. So you'll need it to be long and thin, and for that you need the ciliary body to relax, to tauten up the suspensory ligaments and turn the lens into a long and thin lens. Whereas if you're trying to focus light from a source that is very close to the lens, then what you'll need is the lens to be much more globular, so you'll need to contract the ciliary body, slacken the suspensory ligaments, and let the lens adopt a much more thick and fat shape, and that will be a more powerful lens, and it will have the ability to focus the light rays that are more divergently coming into the lens, because the source is so much closer, onto the back of the retina, because it's got this higher power. Its ability to focus light rays is greater, so it will do it with a shorter focus distance, or focus length as you could call it. Okay, right, so that then is all I want to say on the physiology of the lens. Now let me actually discuss what a cataract is, and then we'll have a break, and then we'll talk about cataract surgery. Okay, so what is meant by a cataract? So a cataract is a lens that is diseased. It's a lens that has gone cloudy. So a cataract, the definition of cataract is a cloudy lens. So what can cause the lens to go cloudy, and indeed what does having a cloudy lens cause? Well, actually I'll answer the second of those questions firstly. So if the lens goes cloudy, it's not going to allow light to get through it as easily, and therefore your vision in that eye is hugely disrupted. And indeed, if it gets bad enough, it can result in complete blindness in the eye that has been affected by the cataract. Okay, so that's why this is not good. what actually causes it? Well, the main thing that causes it is just age. So the main cause of a cataract, of getting cataracts, is what we call age-related cataracts. And what basically happens is not particularly understood, but the lens goes cloudy as you get older, and this seems to be something that is unavoidable as you get older. It doesn't seem, we haven't found particular risk factors that are involved in it. It's just something that seems to happen as you get older. It's one of these imperfections in the design of the human body, that as we get older our lenses become cloudy and eventually can get to the point where you can't actually see light through them. What is understood about why they actually go cloudy is it seems to be problems with the crystalline proteins inside the lens fibres. They seem to denature as time goes on, and this seems to disrupt the ability of light to actually move through the lens, and instead the lens ends up going cloudy. So problems with the crystalline proteins inside the lens fibres are believed to underlie why the lens goes cloudy. Things that can also cause premature cataracts are if you have excessive exposure to ultraviolet radiation. So UV radiation can also damage your lens. So if you look into the sun too much, sunbathe too much without sunglasses on, the ultraviolet radiation can damage the lens fibres and also lead to cataract development. That's another big thing. Also, other risk factors that we know for developing cataracts prematurely are if you have poorly controlled diabetes mellitus, so I'll put that down. So diabetes mellitus can cause it, and diabetes can cause a huge number of different things. It's the elevated blood glucose, the chronically elevated blood glucose. It can damage a huge number of different parts of the body, and the lens seems to be another one of those. So that's another thing, another major risk factor to be aware of that can lead to premature cataracts. And of course, diabetes mellitus, poorly controlled diabetes, can lead to all sorts of other pathologies associated with the eye as well, retinopathy majorly. Okay, so that's the definition then of a cataract. It is a cloudy lens that disrupts vision. In the next video, what we will talk about is cataract surgery. So what this involves doing is removing the cloudy lens and replacing it with an artificial lens. Now, as I said when we were discussing the physiology of the lens, the problem with this is that this artificial lens that we put in, it's not going to be able to accommodate. So once we put in this artificial lens, you've got your cornea and this artificial lens, and that's fixed now. You can't adapt that visual focusing tool work, machine work. It will be ideal for focusing objects that are emitting light rays that are a certain distance from the eye onto the back of the retina, but then objects that are outside of those ranges will not be focused so well. So we'll talk about that in the next video. So we'll go through the procedure for cataract surgery, and we'll also talk about this problem with only being able to focus objects that are a certain distance away from the eye onto the back of the retina well in the next video.